Hey, FCBC family, it is Pastor Mike here, and it is Friday night. Usually at this time, we have the Inward Journey, but not tonight. We're back for round two of a necessary conversation that we have to have in our community, and that is about the COVID-19 vaccine. There is still a tremendous amount of hesitancy in our community around the vaccine. And the first time we had this conversation, it was really to educate people around why the vaccine was safe. But guess what? We still have to educate people. There's still persons who are hesitant, leery, suspicious, operating in myths. So we still have to do that work of demythologizing the narrative around the COVID-19 vaccine. And so I'm grateful for that. I'm grateful also tonight to be partnering with the Ad Council on this initiative and to educate our community about the vaccine. And I'm grateful since our last panel, FCBC has been a vaccination site. We will be a vaccination site again. We were able to vaccinate over 1,400 people. It was an amazing effort led by Pastor Heaven and a team of amazing volunteers. And so we're grateful for that. And so again, welcome everyone to tonight's conversation, Speaking the Truth. Remember, let me know where you are joining us from, and so I can shout you out. Harlem's in the house, the Bronx is here, but again, grateful for all of you. And I have to say this, I read a t-shirt not too long ago someone had on the panel I was on, and it said, if you want to get anything done, get a Black woman. Now, let me tell you, I'm in 100% agreement with that. 100% agreement with that. And tonight I have three dynamic sisters who are amazing, who are talented, who are gifted. But more than that, they have a heart for our community, a passion for people, and want to see the best for our family, for our communities. And so, again, grateful for you and grateful to see them. I want to introduce them. Now, two of them you should know. If you joined us last time, you will know. None other than Eboné Carrington. She's a CEO of Harlem Hospital. And then joining us again is Dr. Haydée Brown. She is the founder of Black Women Orthopedic Surgeons. She's also currently now the interim chief of orthopedic surgery at Harlem Hospital, and an all-around amazing woman. And then last but not least, new to this group, is a friend of mine for over 25 years, Pamela Sutton-Wallace. She is the vice president and chief operating officer of New York-Presbyterian Hospital, Weill Cornell Division, and we're so grateful to have them. So family, let's welcome Eboné Carrington, Dr. Haydée Brown, and Pamela Sutton-Wallace. All right, let me give you all the chairs. Let me give the chairs. All right. Great to have all of you tonight, and I've been looking forward to this conversation as well. It is one that we promised Eboné and Haydée that we would do again, and so I'm grateful to be doing it, and grateful to be joined by my sister, my friend Pamela Sutton-Wallace, who's new to the crew but not new to this work. And so I'm grateful for all of you. I think the timing of this conversation is important, in particular in New York City, now that we see the city basically is opening back up. I have some serious concerns about that. I understand the decision by the mayor and others, because that decision is really an economic decision. It is a decision because our city, whether we know it or not, is in a financial crisis. As I've shared with some people, the only thing that is preventing a financial collapse is this kind of infusion of the stimulus money into the economy and into a place like New York City. But once that stops, we're going to be confronted with a reality of people who have left the New York City, businesses, in particular small businesses, small minority-owned businesses that have closed, people have lost jobs. And it is a precarious situation in our city. And on top of that, this is going to be a very interesting summer. Now, what is interesting is there are people who are behaving as though the vaccine and the pandemic is not going on anymore. The attitudes I hear in conversation, the people I see on the streets, and it doesn't help that the CDC has said that if you've been vaccinated, you don't have to wear a mask outdoors. The mayor has opened the city. So I just want to begin by getting your responses to the situation that we're in right now. We have the summer is coming. The CDC has lifted some of the restrictions. The city is opening back up, and we still, in our community, are underrepresented when it comes to being vaccinated. I want to hear some initial thoughts from Eboné with regard to this.
Sure. So I think one of the things that we need to make sure everyone appreciates is that none of the guidance that the CDC gave prior is invalid. I continue to say that those big four are the four that are going to carry us through the next year and the next 18 months. So I will not be removing my mask, and I don't think that that's advisable because you can still contract COVID. And even if you're vaccinated and contract COVID, you may not succumb to serious illness. You definitely will not die from COVID. However, there are still symptoms associated with having COVID and these after actions that we're seeing. So folks are having post-COVID syndrome. They are having deep depression. They are having cardiopulmonary issues. In some cases, people who never used a rescue inhaler before can't walk 2 or 3 blocks. So I really want people to understand the textures and the hues of COVID. We're vaccinated, yes, but COVID is still around. People who have significant comorbid conditions can still get very sick from COVID, specifically if they're unvaccinated, which many of the people in our community are. And because our children under 12 are not able to be vaccinated, to me, I don't want to abandon them. To take your mask off, to discontinue your testing cadence, to not continue to wash your hands, and to then recongregate, or to kind of partake in congregate settings where you're not masked up or where there's not appropriate social distancing is unwise. And you would never have ever heard me say anything contrary to the CDC. But I'm just going to say to everyone, stick with what we taught you before, because it's how you stayed alive before. It's how we discontinued contagion. And while the numbers are decreasing or dissipating around hospitalization and mortality, people are still getting COVID. And we are still studying this. So we don't know what COVID looks like 2 years out. We don't know what COVID looks like 3 years out. And the mental health that's associated with, or the mental stigma that's associated with what's happening from a PTSD perspective is significant. So I'll just touch on that one thing, which is now let's take our masks off. And I do not think that's advisable. I would not want anyone to do that. And around vaccination, I'm just going to say it and then I'll pause. We need to continue to get vaccinated. We don't want to die. We don't want disproportionate rates of mortality. And so we'll have to talk to some folks today about just continuing to get vaccinated, because if you want to stay without your mask, then we all need to get vaccinated. And so until we get there, I'd like to have everyone continue their prophylactic steps.
Absolutely. Pamela?
I agree completely with Eboné. I think it's really important. We're all tired, right? Everyone has been, practicing social distancing. We haven't traveled. We've been masking. The weather's getting nice. We're all anxious to get back to what we feel like is going to be a new normal. But I think that being said, we don't know who's vaccinated or not, right? We don't have policies where everyone's required to carry their card, and I'm not sure that's the right policy necessarily. We know, looking at the current statistics, only 22% of Black New York City, or of those who are vaccinated in New York City, only 22% are African American. That means in our community, we are more likely to be infected with COVID still. We already know that we were disproportionately affected anyhow, but now because we remain unvaccinated, we are at greater risk of contracting COVID. Now, we do understand that the burden of hospitalization and disease and death is declining. However, just as Eboné said, when we do contract COVID, we know that our patients still remain terribly ill. Those who are presenting to the hospital are much more acute. We still have in our hospital system anywhere from 25 to 30% of those who are hospitalized who are in ICUs. And that ICU time is not pretty. It is high intensity care. We call these patients long haulers. They stay ill for much longer. They end up needing post-hospitalization care that is extraordinary. We don't know, as Eboné said, how long they're going to need care. But there's no way of knowing if you're going to be a long hauler or someone who just has like flu-like symptoms. Why we would take that risk at this time, just wouldn't do it. Now, what we do know, based on the CDC information, that you can probably go unmasked outside with good social distancing. But many of us who live in the city understand it's really hard to social distance in our communities. And so why we should err on those, to be on the safe side and mask. In addition, even if you are vaccinated, you could possibly be a carrier. We do know that the viral load is lower in your system if you should contract COVID after being vaccinated, but there's nothing that's clear about what's your ability to transmit to other people. And certainly we wouldn't want to transmit the disease to those we love and who live in our homes.
Absolutely. Dr. Brown, I'd love to hear from you.
Good evening, everyone. Both Eboné and Pamela have said a lot. One thing that I wanted to drive home is that it is a new virus. It is the novel coronavirus. So we have experience with novel coronavirus through right now. We don't know, as you said, what it looks like a year from now, 6 months from now. And remember that there are now more variants of this virus. And so we're not sure, for example, that the Indian variant seems to be a very aggressive variant, right? And it's just extremely important for us to keep in mind that within our communities, we are not at herd immunity. I know there's 8 states that are right now, and we're close. We're somewhere in that like 60%. But within the Black community, within Black and Brown communities, we are not immunized to a level that's safe. And it doesn't take much to just close your eyes and remember what last year was like. It was horrible, and we all experienced that. And we still do not have a cure, but what we do have is a way to protect you and your loved ones from getting critically ill or from dying if you're exposed to coronavirus. And that's the best we have right now. And so it's not just incumbent on us to get vaccinated for ourselves, but it's really for our loved ones. It's for everyone that we interact with. And I walk around here in Harlem. We're definitely less than 6 feet from one another. And I'm not sure who's vaccinated and who's not vaccinated. And I would never be able to live with the fact that I could be a carrier and give it to someone who then gives it to someone who's immunocompromised, whether that's someone who's more able to get COVID because of their age or because of any other diseases. We have to use the tools that we have. And the tool that we have is the vaccine. And just to continue with the masking, continue with the social distancing, and continue with the hand hygiene. And I am equally exhausted, if not more, for doing all of those things. But then it just takes a moment for me to remember and I'm vaccinated, but it just takes a moment to remember the consequences of not following these recommendations.
Yeah. I appreciate that. And you shared your story last time, and I know intimately your brother-in-law who passed away from COVID. And I think for those of us who've had loss in our family or friends, we understand that it's nothing to really play with. I'm looking at some of the comments. And let me also say to those who are watching, in the comment section, if you have questions that you want answers to tonight, we'll try our best to answer them, but you can put your questions in the comment section. I see a comment by someone, BJ, who said that they're not feeling well. Their mother got the vaccine and has a similar condition to me, and how she's not, and BJ saying, I'm laying here not feeling well, not feeling good. Now I'm super scared to get a second one, and it's just known for the first shot. Well, let me say this. I can speak from my experience. One, everyone, I was hearing from everyone say, the second shot. Now, I am immunocompromised. I don't have antibodies technically. And I was preparing for the second shot. For me personally, the first shot did me in. And I did not see that one coming at all. And it started with about 3 days of extreme fatigue, just tired. And then on the 4th day, I don't think Ebony, I even mentioned this to you. On the 4th day, I broke out in hives. And it was and I was in shock. But the second dose, there was nothing, no issue at all. So I want to tell BJ who's watching, listen, think about our children. And I think we said this last time in our panel, when our children, our babies get vaccines, how they have fevers, they're crying. We're going through the same thing. We're just adults. I mean, that's our bodies adjusting to what the vaccine is seeking to do and build us up. So don't be afraid The worst thing to do is to get the first shot and not get the second shot and think that you're partially covered. You need both shots. And in spite of what you may be feeling right now, it won't last forever. And you move forward. Remember, the theme for this year is, I am resilient. You're resilient. And so you'll be able to push through. You'll be able to push through this. I want to just raise a few things. What do we say anew? And all of you can answer at any time. Because what is amazing to me is that the group within our community that seemingly is the most hesitant is the group that has the most access to information. That's young people, right? That group in our community, amazingly, is a group that is hesitant and refusing to get the vaccine. What do you say to young people? I'm talking about people in their 20s and 30s who are saying, I'm not doing it for all these mythical reasons. What do we say to our young people?
Yeah, I think we came out the gate, I think, declaring that this was a disease of the elderly, right? And many of those who succumbed were older populations. But quite a bit of that was because the older populations were living in communal housing, particularly in nursing homes, or living with other people in their homes. And as a result, they were contracting disease, and they tend to be more immunocompromised. But that gave us the impression that this was an older person's disease. In fact, this disease has no consideration for age. Now, generally, younger people tend to be healthy, so when they do get sick, it doesn't tend to be as extreme. However, when vaccination rates started going up among the elderly, guess who's now in the hospitals and hospitalized? It's younger people. And so the average age of hospitalization, I would say early on, was in the late 60s, early 70s, maybe even older. Now that average age has shifted. And so it is indeed clear that remaining unvaccinated puts you at tremendous risk of contracting COVID. And I would say young people who generally want to go out, right, who generally want to be with their friends, are traveling perhaps more than any other group of people, really need to give careful consideration to become vaccinated and really sit and listen. I also understand that young women in particular are very concerned about their fertility. And recently we've heard a lot of concern around with young men who are concerned about virility, and understandably so. The data suggests that all of what we do know now is that the vaccination does not appear to impact either of those things. It is far more risky to actually contract COVID. That is more likely to cause you morbidity and mortality than any of the other two.
Yeah.
I would add that even living with COVID, so surviving a COVID infection, is not a wonderful life or a wonderful path. And we have not really discovered we still don't even know the after effects of having COVID. I mean, we understand that there's long haulers, and we know there's mental status, there's mental, whether there's depression. We also know that there's a higher level of inflammation around your heart. So if you may have recalled from our last panel that some of the younger folks that had COVID, they looked at this one football team, and they were actually asymptomatic or had very mild symptoms from COVID. And when they finally looked at they had some, occasional symptoms. When they screened them, they found that their hearts had been damaged from COVID. And they had very mild symptoms to no symptoms, so much so concern in terms of their heart that they were held back from participating in sports. And who knows if they can return yet. We're just looking at that data. So it's important to know that although you are young and healthy, this population, right, the 18 and above now, are those who can get the vaccine, but you're also that same group that's the ones that are showing up with this illness. And we have a tool to stop it. So it's super important for us to do that.
Yeah.
The only thing I would add, Pastor, and I have to put a little bit of levity and comic relief. I talk to the children like I talk to the children. And so I well, do you drink? Do you smoke? Do you do other things? Do you smoke hookah? Do you do many of these other, you eat preservatives? And as I talk with them about why the vaccine, they talk about ingredients, not knowing, really succumbing to a very vicious social media cycle that is perpetuating. And I don't want to be a conspiracy theorist, but there are things that are dropped into our social media that help inform our conscience. And so many of the young people that I'm talking with that are reluctant to be vaccinated are subscribing to this. And so as I talk with them, it's really to figure out, what's your hesitation? You have been vaccinated your whole life for the most part, because you couldn't have gone to school. You know, our system is heavily reliant on vaccination, even for entry into school systems or into correctional facilities. So people have already had vaccine. The question is, what about this is causing you so much pause? And when I talk with them, it's really just about the unknown, about the makeup of the vaccine. So I think we should just share quickly, to circle back to the first talk. There's no live virus in this vaccine, which is what I hear a lot of people say. The mRNA technology is not rushed. So this is established 2 decades worth of science to help us get through this pandemic. So honestly, as I talk to offset what they've been given, they're receptive. They're equally receptive to the facts as they are to the rhetoric. And the rhetoric is strident. I mean, it is really sad what's going out. They think there's a microchip in this virus. I've talked with people who are really just paralyzed with fear because of misinformation. So they just have to talk to credible messengers. They have to be communicated with in a way that meets them where they are. And on top of that, I've not met one young person that doesn't love their grandma, their abuela, their nana, their titi, whatever you want to call them. They love somebody who's susceptible. And as I talk with them about how they engage with their adults and how they engage with people that they care about, I've actually seen a lot of converts. And the last thing I'll say is we vaccinated the first 2 14-year-olds, at 8 a.m. as soon as the emergency use authorization went forward. And one of those young boys of color said, 20 people in my family died last year. I want to be the first in line. So I just want to leave it there, because this young boy has seen so much death and dying that he ran to be the first person to be vaccinated. So I just share that story with so much pride and admiration for this gentleman. But he was struck by significant grief and mortality, and that's what brought him there. So I think we just have to let people keep living, experiencing, and seeing that people aren't dying from the vaccine, because eventually they'll just start walking in more.
Yeah, a couple, you talk about levity. I had a young person tell me similar thing that you just said. I heard they're putting a chip to keep track of us. I said, man, you have a cell phone. Don't nobody need to put a chip. You have a cell phone. You got a debit card. Nobody needs to put a chip. You have chips already. You walking around being tracked, right? So that's something. There's a question here from Natasha. I don't know if you all said it in our producer, Ian. Can you pull it back up on the screen? She said, I've read that you shouldn't take the vaccine prior to getting your mammogram. They said it could cause a false positive reading. Is that true? Have you all heard this?
I'm not familiar with that. I know that, now vaccines are pretty widely available, but when you are eligible to get the vaccine, you should get your vaccine. You have to even think, even if you have a false positive for your mammogram, you're protecting yourself against COVID.
Yeah.
Pastor, the thing that folks should know, the only thing that precludes you from getting a vaccine is if you actually have COVID, if you have had monoclonal antibody treatment within the last 90 days, or if you have been vaccinated for any other reason, whether that be shingles, pneumococcal, or flu vaccine, you must wait 14 days before being vaccinated. Those are the only clinical criteria that would disallow you from getting vaccinated. And of course, we ask people to talk to their physician, but to Dr. Brown's point, we haven't heard that. And I just want people to know those 3 criteria are the only one that the Department of Health have outlined as exclusion criteria.
And I got to add, the greatest purveyors of conspiracy theories is that amazing group that has powerful effect in this country, and is they. I don't know who they is, but they say, and they said, and they said, I don't know who they, but they show up everywhere. And so when you hear that, check the sources. As Ebony said, they're credible messengers in our community. And more than that, do your own research at the same time. That we're in an age where facts mean nothing anymore, right? It is followers over facts. It is opinions over truth. And so I think that at this moment, we have to be vigilant about that the conspiracy theories abound. And we have trigger words. You know, we talked about this last time. One of those trigger words, I didn't share this. I think this happened after our panel. You know, my 12-year-old niece said to me when I told her I was vaccinated, she said, Uncle Mike, why'd you do that? I said, well, why wouldn't I get vaccinated? She said, well, Tuskegee. Watch this. And I said, okay, tell me about Tuskegee. She couldn't tell me a thing about it. Right. But it's these catchphrases now that there's this shared assumption of meaning and fear connected to trigger words and ideas that are circulating in our community. And I think moments like this, this person said it was actually the MD Cancer Center who said this. Natasha said that. You see Ebony looking up right now. So she's like, let's see what that says. Is it true that 2 weeks after the second vaccine, you are considered fully vaccinated? Pamela?
Yes, that's correct. So once you've had your second vaccine, 2 weeks post that date, you are considered fully vaccinated.
So let's be clear. So we've heard cases, and this is true, that people who have gotten vaccinated contracted COVID within that 2 weeks.
It is possible to contract COVID within that 2 weeks. It's possible to contract COVID afterwards as well, which is why we should still take into consideration the three big interventions: masking, social distance, hand hygiene. What it does is it lowers your viral load that you are very, if you do contract COVID, you're less likely to transmit it to other people, and the severity of disease is much lower than if you were not vaccinated, but it's not impossible to contract it.
I saw we lost Dr. Brown. She had some technical difficulties. She'll be coming back. But I have to ask this question, and I hope, I hope it doesn't make you feel uncomfortable, because you are two healthcare professionals who are respected around this country. And I just have a question, and it's simple. This is my question. Why would the CDC say this? Why would the CDC come out and say you don't have to wear a mask, knowing that what people will do with that statement, how they will run with it? What do you think was the rationale behind this decision to put that out?
Well, I mean, I think there's a lot of pressure to open the country back up economically, right? And we are seeing that directly in New York City and New York State. I think people are weighing the risk. And I think there's also a certain amount of trust that people will do the right thing, having seen the disease burden in the country. So there are often political reasons. We don't know why, but I think it's trying to balance that issue of the economic success of the country with kind of personal responsibility and public health measures.
Yeah. Eboné?
I think they've just really tried to kick the tires on chaos management theory. I'm just going to be very honest with you. Absent trying to get people to do the right thing, they say, well, do whatever you need to. And, like throw the cards up in the air and see where it fares. Because the numbers have decreased so significantly, I think they found that to be a safe space. When you look at the rolling average, when you look at the heat maps of the populations, honestly, as it's still impacting us, how much does the federal government care? And I think that's a very controversial statement to make. But if this was impacting affluent people, those affluent people probably got vaccinated. So now you have to really look at the power dynamics of the nation. You have to look at who's brokering our federal economy. And when you see that the rich people have gotten vaccinated, and I just want to offer you, when we opened up to vaccination at Harlem, every single solitary person that was in my lobby was white. These are people who had no medical record number here, which means they've never come before, or to any other hospital in our system. These people had zip codes that were dissimilar from our hospital. In some cases, they drove long distances in limousines to come to Harlem Hospital to get vaccinated. So now that they're vaccinated, do we really care who else didn't get vaccinated? Is really what this says to me about our country's thought process. So it saddens me when I saw that guidance come out, but I think to Pam's point, you got to open the country up. why not do it in a way where people can get incentivized by taking their mask off if they're vaccinated? And I just think that was a poor incentive because people were doing it anyway. And I hope it doesn't facilitate a third wave. That's all. That's all I would.
Yeah. Go ahead.
I would agree. And again, you have to keep in mind our community, which is not at that level of herd immunity. So it's so important for us to continue with what's kept us safe thus far, because the alternative really isn't worth it.
Yeah,
it really isn't.
Someone has asked, actually 2 people have asked in the comment sections, basically about the variants and potential need for future shots. And someone just asked, are we going to end up having to get a booster shot? And I've heard Dr. Fauci talk about, he sees like around, for some who have vaccinated spring, around the fall, another booster shot. Let's say something about this booster shot I hear people talking about.
Yeah, there's been a lot of conversation about, again, this is all not all of it, but it's new to us in terms of this specific vaccine. And we're still learning how long does one's immunity last post full vaccination. And as time goes on, we learn more and more how long we think one's immunity will last post the second shot. There seems to be a suggestion that we will likely need a booster. It will likely look and feel like a flu virus. Like when the flu every year, we change slightly the vaccine to match the variant of what is likely to be that particular year's strain. We think there's going to be something similar for COVID. But again, I think the jury's still out. When that would happen, is it a year later? Or is it, 18-month booster, 24-month booster? Is not entirely clear. I think we're still learning, as Dr. Brown said earlier, about the variants. The variants are taking place. We knew this would happen. The Indian variant wasn't even here, I think 2 months ago. So as the virus mutates, depending on the severity of it, may mean we have to make adjustments to the vaccine itself, but it takes time. And unfortunately, when you do make adjustments to the vaccine, it takes a certain amount of time to get that vaccine to market. In the meantime, again, the virus can mutate. It's another reason we're trying to encourage people to get vaccinated as soon as possible now so that we can build herd immunity, so the likelihood of variation later on decreases substantially.
Someone asked, I'm sorry, go ahead, because someone asked a question about herd immunity. Someone just break it down. So if someone can just be able to feel comfortable, what is herd immunity? We know what it is, but I want to hear you all explain to someone what herd immunity is. Whoever wants to do it, Ebony, Dr. Brown.
So herd immunity represents the number of people that need to be vaccinated for all of a population to be protected. So it's to say that, say there's a building with 100 people in it. If we have 70% of those people vaccinated, then that's protective of the entire building. And we're not at that level in the majority of the country. So that's why it's important to become vaccinated.
Yeah.
There's really the protection of many that protects the one. So folks that may not be able to have a vaccination or get the vaccination, or maybe more susceptible, or perhaps it's a variant that would impact them. If we have enough immunity, meaning that 70%, then that is protecting them as well. So we have herd immunity we've had herd immunity for, say, the measles, right? We've had that for a significant period of time, but then now there are groups, there's different neighborhoods that do not have the proper level of vaccination to protect the entire community from measles. So it's the same concept.
One of the things that people have to understand about a virus is it loves to change. And as it goes from person to person, why this was such a virulent virus or why it caused so much severe illness and mortality is because as it was moving so quickly from people, a slight deviation is what makes a variant. And that's what people have to understand. You bring something from another country, there's a mutation. So the North American variant, people were like, well, how does it vary? Because it's from here. It's because from person to person, the virus can mutate. And as you are vaccinated and as your body does not mount that immune response to COVID, then you're not going to be able to mutate it. So I think it's really important for people to appreciate that their vaccination is like a pay it forward for the rest of the community. So even if it does not compel you individually, as a collective and as an accountable member of the community, that could be a reason that someone makes that choice today. And I wanted to make sure that people don't begin to have the conversation around the booster as an automatic and kind of predisposed deterrent. So why is that deterring you? If you need a booster to keep you alive next fall, get a booster. And if you are now not wanting to get the vaccine because there could potentially be a booster, you really have to reconcile all of those conversations with yourself. Because people just like to throw it out there and say they didn't know enough, so you need a booster. You get a flu shot every year. You get many other medications prescribed for you from your doctor every year, of which you do not know the pharmacological makeup. And so I just want people, before they go to pharmacy school on the vaccine, you got to go to pharmacy school on everything. And so just really have a valid argument if you are, or a valid conversation. And so if you're skeptical, go get the facts, but don't use these small obstacles as the reason that you and others are not going to get vaccinated. So yes, there may need to be a booster, and let's all go get that booster.
Yeah. I had two other questions I want us to address. For BJ, she clearly, she's gotten that first shot. She's not feeling well. And what she wants to know, and again, in layman's terms, we've been doing it. I thank you all because you've been doing an amazing job communicating and helping us understand, helping me understand. But help BJ understand why when she got this shot, she feels sick. Now, my reference early was when we were children, we got sick but in terms of science, why is she getting sick? And why do some people get sick when we get the shot?
I can only speak about it in very layman's terms because I am not a physician, and certainly Dr. Brown's probably the best positioned here. But my doctor friends have told me, because I too was a little nervous and hesitant when the vaccine came out, right? So I started asking a lot of questions, and the way someone explained it to me is the mRNA vaccination is presenting to your body.
Hold on, what's the mRNA? So they understand that. That's
the packaging of how the vaccination is delivered to your body. It's part of your. I'll have to have Dr. Brown help me here. I don't think it's genetic, right? It's part of your genetic makeup.
Right. So the mRNA is a code that tells your body how to produce proteins. So what mRNA is with the vaccine is that it's giving your body the ability to fight the coronavirus or SARS-CoV-2 without actually being infected by it. It's basically, if you think of it, a key and a lock, it's showing it this key that's very similar to coronavirus, but not coronavirus, so that you know what this illness is. And then the reason why you feel sick, I'll defer back to you if you'd like. Well, the reason why you feel sick is because your body is fighting. So and it's not to say that folks that don't have, the fever or chills or the soreness, that's not to say that your body isn't fighting. Everyone's body reacts differently. But what you're experiencing is a taste of the response that your immune system is building, so that when it actually encounters coronavirus, SARS-CoV-2, that it can fight it. And we know that it can fight it effectively and keep you out of the ICU and keep you alive.
Yeah. So the only other thing, I think sometimes is repetition, because each story may resonate with different people. So BJ, the sickness that you may be feeling is very similar. It's like an audition, or it's like rehearsal for a Broadway show. So if you really got COVID, you'd be on Broadway. You would be sick or not, but this is telling you, this is what I would do if I got COVID. It's not giving you COVID. It's not making you sick. It's telling your body, I'm introducing COVID, but not really. And your body is saying, this is how I would fight it. For some people like me, my body did nothing as a result of the vaccination. So maybe I would have been one of those people whose body did nothing when they got real COVID. When we were talking with Dr. Brown the last session, and while I was talking with some of my other colleagues, they got very, very sick. Sick like flu-like illness, sick like rigors, like you were shaking. So the fact that you're feeling sick right now, BJ, is actually a good thing, because it means your body's working to fight that fake coronavirus and it's fake. That's why I keep saying it's fake. You don't have coronavirus. You weren't introduced coronavirus, but your body is now acting as though it got coronavirus. And the fact that you're sick and it's not that sick and it will go away in a couple of days is so much less than perhaps what your body would have mounted, or the sickness that you would have encountered. And I'm looking at your picture, you're young. So you're the person we're talking about, that if you got COVID and you were this sick with the vaccine, you might have been this sick with the actual virus. So number one, I hope you feel better. Number two, it means it's working. And number three, on the other side of how you feel, you will be fully protected from dying from COVID. So you made a great choice. Go get your second shot and then tell your story to others when you feel better in a couple of days, like you've never felt before. That's what you should share.
Yeah.
And I think I may be, and I'm just going to give my little 2 cents. I think of all of us, am I the only one who actually had COVID? Yeah. So let me tell you, the 2, 3, 4 days of not feeling well does not compare to when you get sick from COVID. I was sick for 3 weeks, coughing, pneumonia in both lungs, hard time breathing, a horrible cough, chills, fever that would not break, weak. I mean, this was 3 weeks. So when I got the vaccine, the 2 or 3 days of not feeling well, that not feeling well is not COVID not feeling well. Let's be clear. I know people say, well, I had COVID symptoms. You may have some flu-like symptoms or a fever, or like I said, chills and soreness, but I had COVID. And when you spoke, Haydée, earlier about young people, my son last year contracted COVID, who was at the time was 29. It attacked his heart. He had to be rushed to the hospital with a blood pressure that was so high, like he was about to have a stroke. Mm-hmm. And when they got there, they didn't know what was wrong with him. They gave him medication to bring his blood pressure down, gave him a COVID test. A few days later, said, you tested positive for COVID. And they saw the damage, the inflammation around the heart. So young people are more, for some reason, as you alluded to, are more susceptible to this manifestation of the inflammation around the heart. And that has been coming with a lot of young people. And if you recall, there was a period in the heat of it where young people were dying of strokes from COVID, right? So, I know what I realize is that for many of us, think about this is a once in a generation thing. The last time we've seen it, 1918, over 100 years ago. And I think, and many of you have alluded to it, what I think the fear is because we've never seen this before, right? We've never experienced anything like this. And as was said earlier, this novel coronavirus, it is new, which means there's no cross-reference for this in our experience to say, oh, this is how we deal with it. We don't panic. And you all can tell me, and Dr. Brown, you can tell me as well. I was on a meeting of clergy around the country, and there was a physician from Johns Hopkins who was answering some questions from clergy, because a lot of questions that clergy were asking, questions from the congregations that they were serving. And they were asking, I saw someone ask about the Johnson & Johnson vaccine. And I think the number he said was that the possibility of having an adverse effect from Johnson & Johnson was like 1 in 7 million, right? And then what he did is of someone like getting adversely sick. And then he broke down other things that you are more likely to potentially die from than the Johnson & Johnson vaccine. He talked about women. He said the likelihood of a woman having a miscarriage is far greater than someone getting sick from Johnson & Johnson. He said the likelihood of someone dying from the flu is far greater than someone getting sick from Johnson & Johnson vaccine. So I think sometimes we don't, as Eboné alluded to, it is hearing the message in ways that we can receive it and have a way of understanding and comparing it that kind of calms a lot of the anxieties. I want to shift gear. Oh, go ahead.
I was just going to say, to really put things in perspective, you're more likely to be struck by lightning. Literally, you are more likely to be struck by lightning than you are to get sick from the Johnson & Johnson vaccine. Like, we just have to keep these things in perspective, right? Like 1 in 7 million is the what's happened in terms of these reactions for the J&J vaccine. So, willing to take the odds, you actually are also more likely to have a blood clot with COVID than from the J&J vaccine. So again, the vaccines are incredibly safe. They've been tested. And, again, I would take those odds, definitely take those odds.
And Pastor Mike, I think what you're also alluding to is, if you've never seen someone sick with COVID, you would have a different opinion about being mildly sick with the vaccine. It is just a disastrous disease. And unfortunately, we still don't know who's at risk for having really severe illness relative to moderate symptoms of, cold and flu-like symptoms. And so why would you take the chance and the risk and just the high morbidity and mortality associated with it? It's absolutely devastating. It's not just devastating for the individual, but it's devastating for their families, for the loved ones. It changes what we know is particularly those who become long haulers, who, again, we can't predict who those people are going to be. Their life is forever changed. And we don't know how long that would go on. So why take the risk? It is a little bit of risk and reward. And if, why would you put yourself or your loved ones in that position?
And I like what Dr. Brown said, because if think about it, we're at a greater risk of getting struck by lightning than something going wrong with the Johnson & Johnson vaccine. Now, watch this. But nobody's walking the street saying, my God, I'm worried about lightning hitting me, right? So we're not walking around in panic every day when it starts raining. Oh my God, I'm gonna get hit by lightning. So I think it's funny if you say that, but if you think about it, it then says that the anxiety is not connected to the real possibility. The anxiety is connected to the fear, right? And so we always have to be mindful. Person said this vaccine is protection, not a cure. Absolutely. This is why you still have to wear the mask, still have to be serious about sanitizing, cleaning your hands, all those things. You can't not do that. So, I'm of the opinion, I don't care what the CDC said. I don't care what someone told me, asked about the church opening up and said, Pastor Mike, I was doing some forum, I think it was a Friday night inward journey. Pastor Mike, the mayor said that the city gonna be open up July 1st. Are we gonna have church? I said, let me tell you something. I said, he's the mayor of the city. He's not the pastor of First Corinthian. And so that's not happening. It's not gonna happen. And I think it's because one statistic I heard tonight, and I'm gonna correct me if I'm wrong, Pamela, because you said this, and you all can kind of affirm it. Only 22%, you said, of African Americans in New York City have been vaccinated. Is that what I heard earlier? You're on mute.
Okay, that's what's on the NewYorkCity.org website. That of New York City residents, only 22% of those vaccinated are Black.
22%. So let's now let's break down.
And let me say it's fully vaccinated. So meaning have both.
And I think,
so let's just go ahead.
What we all, and I think whether you went into it to be a clinician or an administrator or a paraprofessional, we usually go into healthcare to offset disparities. Like my whole career has been dedicated to trying to make way for us to be healthier and to have a path to at least a fair shot. Passive participation in this vaccination process is going to make COVID like all the other things that we suffer from more than anyone else. And I think that's what we have to talk about. There is a hypertensive divide, there is a diabetic divide, there is an obesity divide, there's a cardiac disease divide, and people of color have that more than white counterparts. This will be like that if we don't start to become active participants in the vaccination process, because they're tagging in. So when they don't die from COVID, or when they don't get sick from COVID, or when they're not in the ICU from COVID, and we continue to do that, it creates the disparity. This is a choice. Tuskegee was not a choice. And also Tuskegee was about withholding medication. Just because I know people talk about Tuskegee a lot, that was the withholding of a known treatment to a group of Black men so that they could experiment on them and figure out what syphilis did to their body over an extended duration. So they didn't vaccinate them or they didn't inoculate them. Your choosing not to be inoculated is replicating Tuskegee. It's not coming against it. And so a lot of the stuff that people are talking about just needs to be fact checked. So we really need to tag into this, because then our comorbid conditions, all the disparities that we're trying to offset, they just become exacerbated. And then we truly can't rise because we won't be well. And this is, it's not to draw from something small and make it large, but this is going to be that if we do not get vaccinated and if our people continue to suffer and to succumb to this variant differently or virus differently.
Yeah. You're muted. You're muted.
Let's just go through what it's like when someone's critically ill with COVID. So, and Pastor Mike alluded to this earlier. We just, now it's a year and a month since my brother-in-law, Zeke Cousins, who was a member of FCBC, passed away. He was only 46 years old. And he was a big, tall, brilliant, exuberant, amazing man that we all loved. And this vaccine took him out. And I was actually.
Not the vaccine home.
I mean, sorry, the virus took him out. Excuse me, I misspoke. Do not the virus. The virus. COVID-19 took him out. It killed him, not the vaccine. And we were there. We actually were able to be there when he transitioned. And again, he went from this amazing 6'4", boisterous, vibrant guy to Zeke in the ICU at Cornell. They did a great job. When his liver stopped working, his kidneys stopped working. So he was on a machine to act like his kidneys. Of course, he couldn't breathe on his own. So he was on a breathing machine. And he also had multiple blood clots because at that time we didn't understand the clotting with COVID-19. It didn't respond to the traditional medication. So his heart actually wasn't really working after all of that, right? And he was on medications to keep him alive. And the conversation that I had to have with my sister was when his heart stops, because it's basically stopped, right? The medication is what's making his heart go. The medication is what's giving him blood pressure. When his heart stops, are we going to let him go?
Yeah.
Okay. So we have to really, really keep in mind that a little illness for 1 or 2 days because of the vaccine is not anything like the way it is to be affected by the disease.
Yeah. And I got to share that because that was the first known death of a transition of an FCBC member. And it was tough for me having to be on the phone, not only with Dr. Brown, but her sister. It's not easy. I mean, I think we all could talk about how challenging it is and was and still is. But Eboné, you said something, and we have to understand the health disparities that exist in the African-American community only exacerbate the possibility of the impact of COVID in our communities, right? So we are predisposed for certain things. That means we're at a higher risk of contracting COVID and dying from it. And I think this is what people need to understand, that we're in a space where we, African-Americans, Black and brown people of color in our communities, are the ones who are transitioning at a higher rate of it with the infection. We have to combat that. And the way to combat that is through the vaccine. And the way to ensure we do it are spaces like this where we can have conversation, where questions can be asked. And the hope is that you all take the information that is being shared and share it with those you know who may have hesitation. Listen, our first panel and this one live on YouTube, on FCBC's YouTube page. So you can go back and get the information as well. So please do that. I want to shift before we go tonight to something now. I want Eboné and Dr. Brown to talk about their T-shirts they have on. And I want them to make a connection, Eboné, between that T-shirt and COVID and the COVID-19 virus.
Okay, so this T-shirt is talking about mental health stigma. So on one side, this is actually the inside out of the shirt. So this is the reverse of what the shirt says. And on one side, it says, stop stigma and start healing. And that's meaningful. But when we turned it inside out and I cut mine sideways and did a whole bunch of funky things with it, I wanted people to understand that's how many of the healthcare professionals feel. They feel inside out. They have not been able to replenish themselves. They are absolutely constrained in terms of their ability to take time off. They've been battling with their families, this in school, out of school, work from home. How do I figure it out? Many of their colleagues, and themselves included, succumbed to COVID. And I've had residents, 29 years old in the ICU for weeks. And so when they came out, we threw parties for them and things like that, because the Helping Healers Heal initiative, which is what this represents, is so important across the nation. So I continue to say, when you see a healthcare professional, whether they're a housekeeper, a dietary worker, or a neurosurgeon, love on them, because we haven't had any days off. For 2 years, there's been no days off. There's been no thought about what else we could do except show up for the public and be present to support through this pandemic. And so, number one, we want to normalize mental health care, treatment, and service. So we want to normalize therapy. We want people in the healthcare setting to know that seeing morgue trucks, and I keep giving this illustration because I want to be vulnerable. I came in one day and drove past 3 morgue trucks, and I got on a call with the governor, and it's like a Haney's call, and they say, how many bodies? And it was called Deceit in Affairs. And I'm transacting about hundreds of dead people. I am figuring out how to get morgue trucks or BCPs pulled up to my hospital because the OCME, or the Office of the Medical Examiner, can't take any more patients. Nursing homes, funeral homes can't take any more patients. And I'm talking about them as if it's transactional. How many are in this trailer? How many? These are people with families, people with lives, people who contributed to this society. And so I normalized trauma. I normalized death. And that wasn't regular, because I had to kind of put on this armor. So for everyone who's been a part of this, everyone on this call, yourself included, Pastor Mike, we have to know it's not regular. We've got to seek some help. We've got to check on our strong friends. We have to make sure that we don't shame people when they want to share how they feel. Even if they're conspiracy theorists, hear them. So this is really to say, in communities of color, we don't embrace mental health services as often as we should. We sometimes shame people who say they want to seek mental health services. And so this is really just to say, I am not stigmatizing you. I'm proud of you if you go get help. It's okay not to be okay. And I know that's a little cliche, but that's truly what we need to be sharing with people. It's okay for you to feel sad right now. It's okay to feel anxiety, uneasy, thoughts of hopelessness, but not for too long. And that's where resilience comes in. Once you feel bad, you feel fast, but then you get back up. And if you find yourself unable or unwilling to do that, then those are signs and symptoms of the need to express help or to get help.
Let me ask this question of you all, and thank you for that, Eboné and Pamela. And Eboné kind of just shares with Pamela and Haydée. What have you all been doing? Because I know you all, and I know what you've been dealing with the past year plus. What have you been doing to take care of your own mental, emotional well-being in this moment? Pamela?
Well, I think finding time to rest. As Eboné said, it has not, many people have gone without vacations, time off in the last two years, 18 months. I've insisted that my staff disconnect, right? And it doesn't mean, take a day, but stay on your technology that whole time, but really taking the time to disconnect, have quality time with family. People didn't want to take their time because they couldn't travel. We did a lot of encouraging of stay-at-home vacations, things that you could do online, things that you could do to rejuvenate. We're encouraging people to take self-assessments, mental health self-assessments. We're also encouraging our colleagues to get trained in stress first aid so that we can detect when our colleagues are undergoing a tough situation, or we are seeing symptoms that Ebony and Dr. Brown have described that things aren't well. And how can we then get people referred into the resources that they need? It is amazing. I think healthcare workers in particular are so susceptible to not wanting to seek mental health resources and feeling so stigmatized by being, feeling like they have succumbed to a situation. Many of us worry that this is the next pandemic. I think also saying, I need help, being able to speak up, seeking out therapy, seeking out psychiatry support, and being unashamed about that. I think for me, it's talking to friends, having family to support, and letting all of that out. Trying to remember your purpose, why you're driven to this work. I've been talking a lot to my teams about finding joy again in the work that we do. Unfortunately, the pandemic has resulted in people delaying care. And so now we're seeing those people who are coming in who have exacerbated diabetes, exacerbated hypertension, all of their illnesses that should have been treated months ago. Now we're having to treat those patients, right? So it is becoming quite the dilemma of how to manage that. But I think I need one of those T-shirts, because I think the bottom line is we have to encourage people to press pause, ask for help, and know that they're loved and cared for deeply.
So Pastor Mike, as you know, this church has kept me going during this pandemic. We even listened to one of your sermons as Zeke transitioned. So it's very special to us, our faith, just being rooted in my faith. And then, of course, my family. My family has been incredibly important, especially my sister and my parents. And then really practicing mindfulness. And so meditation, and my son and I have been doing a gratitude journal, which he gets annoyed about. He's only 10 years old. So he's like, Mom, do we have to do gratitude again? But it's really pretty funny. But we started the gratitude journal back in August, and it's actually fun to go back through and see what you're grateful for. Because of course, there's simple things you're grateful for, but then you start to dig deeper and asking my 10-year-old, Gael, what are you grateful for and why? And then he asked that of me, Mommy, what are you grateful for? And I think it helps you keep a lens on what's good and what's there to really hold on to. Because there are, of course, many good things. We're all here. We're all physically here and able to share our experiences. So just being grateful. It's very important.
Yeah, for us, when this happened, I said early to many of the leaders that what we're going to see, as Pamela alluded to, is a pandemic around mental health. I said it's inevitable. And that's why we shifted some things. So at the church, Mondays, with things that I do, all the pastors do things during the week, but mindfulness Monday, I do midweek motivation in the morning, on Instagram afternoon, the inward journey on Friday nights, always incorporating meditation, deep breathing meditation, trying to teach those tools, because it is difficult, and I'm grateful that the way God has led us at FCBC and even placed this on my heart, issues around mental health care have been critical for me for many years now. Me being transparent about my own struggles and being vulnerable for the congregation, and not to be kind of, exhibitionist with my feelings. It was to loose other people up, to feel free enough to speak about their own challenges. Like if the pastor is talking about his depression and the pastor is talking about his anxiety, well, man, then I can talk about it, right? And then we create that space like the Hope Center, where we do free mental health, offer free mental health services, and something that people didn't even realize at the time. In Ebony, remember, we did almost 400 people who were trained mental health first responders at FCBC, not realizing what was on the way, right? And so all those things become critical in this season of trying to find ways not to cope, but ways to reinforce the resilience that is already within you, right? And allowing that to come to the forefront. And I think that becomes critical as we journey along, because sometimes in these conversations, we talk about, the statistics, we talk about the data, we give the metrics, we answer questions, but at the end of the day, it is also about how we become mindful of our mental, spiritual, emotional, and physical well-being, because that will be tested. And it is real. A few weeks ago, I was driving along 125th Street. The Harlemites know when I say this, by the old McDonald's on 125th and Broadway. I said, oh, it's not there anymore. And as I'm driving, coming from the Hudson River, there's police everywhere, fire trucks everywhere. I'm like, what's going on? So and it's backed up as I'm moving through the stoplight right then. I look to the left because I'm seeing people holding up video cameras. There's a man on the ledge naked. And the police, and they got the inflatable big thing on the ground, and the police are trying to coax this man back in. That is episodes like that. We will see more this summer than we have in a long time. And as you alluded to, Eboné, we have to be, and Pamela, all of you, we have to be prepared for what is coming with regard to mental health issues in our community, on top of everything else we're dealing with. And I think about this in particular. That 14-year-old boy, Eboné, who got vaccinated, who saw 20 people, who knows 20 people in his family who've transitioned. We cannot begin to imagine the trauma that he has experienced and will live with. But behind this, how do we help countless young men and women? And in fact, older men and women, because many of us have seen deaths like this. You all have seen it in the hospitals, but many families have known death like this. And now in this summer, as things are opening up and people are coming out and people feel this false sense of security because of what the CDC has said and because some people have been vaccinated, we're going to see a lot more things happening. And so we need to prepare ourselves for that. Here's what I would want you all to do. I want each of you, to give some closing thoughts with regard to why, again, this is essential, to make sure we spread the word about the necessity of getting vaccinated and why it is extremely critical in our community. I'm going to start with Dr. Brown.
Hi, so I would say keep it all up. Keep it up. Meaning continue with the masking, continue with the social distancing, continue with the hand hygiene. Get your shot, whichever one you're available to, whether it's the J&J, the Moderna, or the Pfizer, and also just be sure to take care of yourself and those around you. So when we talk about stop the stigma, there's over nearly 600,000 people have left us with this pandemic. 600,000 people. I can't even process the one that I'm still going through, and that there's 600,000 losses. So it's really, really important to take care of yourself, right? It's really important to be mindful. It's really important to pray or to meditate or to be active. So if you want to follow me on my Peloton, I'm on the Peloton all the time, but it's something that helps me feel better. And days that I'm not on there, I definitely feel the difference. So find out what works for you to help you through this time, because it is a hard time and we're not okay, and that's okay. And get help. I have a therapist. Most of my girlfriends have therapists. We all have therapists, because that's what you need to exist in this world right now, and that's okay. So that's it.
Yeah. Pamela?
Well, first, thank you. Thank you for connecting us all together and allowing us to help encourage our colleagues and our friends and our loved ones. I just want to say, I know one of the things that you talk about often, Pastor Mike, is how God has made each one of us so uniquely and marvelously to do that with which we are individually called to do. You can't live in that destiny if you're sick. And when I say that, I mean whether you have COVID, whether you have other comorbidities, or whether you have mental health needs. This is your opportunity to starve off at least one of those. Protect yourself against COVID, get the vaccination. We know enough now to know that this is a safe and effective treatment. We need you. We need each one of you individually. We need each one of you personally. You're destined to change the world. And to change the world, you got to be here with us. If you need mental health, if you need resources, reach out. We're very blessed to have a Hope Center where resources are available. So many people don't have access to those types of resources. Take advantage of them. You've got 3 sisters on this call who will gladly get you what you need. reach out to any of us. God bless you. Thank you for the time tonight.
Yeah. Ebony?
I would just offer seek to understand. We've talked a lot about misinformation, so understand your whys. Understand why you are getting vaccinated, and if you truly want to rest on not being vaccinated, understand your whys also. Let them be rooted in fact, let them be rooted in evidence base, and let them be rooted in science. And because you're on this call, we follow a school of thought that says, like, challenge what you're hearing. Be actively participatory in this social action, which is vaccination. This is an outgrowth of social justice. We must get vaccinated so we do not allow our community to become, I'm not going to overstate it and to be extinct, but I don't want to see more Black and brown people die when there's a way. And so I want everyone on the call to seek to understand their own role and their spheres of influence. I charge you to get your 1 or 2 bullets, your elevator speech, and go out and talk with people who you influence, who you inspire, people who listen to you, where you have the capability to lead a group of people into information. Please be that. And as Pam said, we are waymakers for that information. And then seek to understand yourself. Practice as much forgiveness with yourself as you practice with others, or as you hope to practice with others. My self-care was forgiving myself. My self-care was realizing I'm going to go home at 5, even though I don't ever leave at 5. If it's not perfect, but it's still done, I'm going to be okay with that. And that wasn't coping. That was truly self-care. Because do you know what it feels to impose stress on yourself? You do not know what you do to yourself in this period and in this moment. So all I would offer is please seek to understand your whys, and please, please forgive yourself and get help should you need it.
Yes, I want to thank you all for sharing that, because all of you have said things that really is iron sharpening iron, and for pouring in. This is a critical moment, and guess what? It's been critical, and it is still critical, and it is extremely important that we in our community take the initiative and get vaccinated. But it is also a blessing to have people like you all who are part of the effort to ensure that more people in our community are being vaccinated and can move forward. Because it is, as you said, Eboné, not to overstate it, but we are in crisis mode, whether we want to admit it or not. When we look at social media or look at TV, it doesn't seem like it because of how the media spin cycle works, but people are still dying. Dr. Brown has said over 600,000 people have lost their life to this virus. It is still alive. The pandemic is still real, and we cannot go to sleep in this season. We must be vigilant, we must be committed, and we must make sure that we do more than just look out for ourselves, but to encourage others to spread the word. We're going to be back again, everybody. For no other reason, I like getting this group together, and I like to be poured into and hear what they got to say. I love it. This has been a blessing. I'm grateful for all of you who joined tonight, and for the questions that were raised, and I thank those participants, our participants, this team, this panel, for answering that. I am a creature of habit, so when I find a good thing, I don't let it go. And so, Pamela, Ebony, Haydée going to be, that all rhymes, by the way, but we're going to all be together again, because we're going to continue to have these conversations to inform our communities. And we'll be back again, because I suspect that this summer, in the latter part of summer, August, going into fall, I think these numbers may start going back up again. And that means we have to be more vigilant in this season. And so again, thank you, Pamela. Thank you, Ebony. Thank you, Haydée, for joining me today and for enlightening all of us and for enlightening me. But more than that, inspiring all of us to do the right thing in this season, and that is to get vaccinated. Listen, it was already said, there are a whole lot of conspiracy theories, and there's a lot of myth making taking place. Do your due diligence and research, study, get the right information, and for God's sake, don't be informed by they, right? Whoever they are, right? I need names to they. I need to know where they are, where they live. But we need to make sure that fact inform our decisions, and not myth making by the proverbial they. All right. So listen, beloved, until next time, and we will be back again, please encourage people you know, your loved ones, your friends, to be vaccinated. Spread the word. This is safe, so that we can not just save ourselves, but save our community. And as you heard that number tonight, 22% of people in New York, African Americans in New York City, have been fully vaccinated. That means 78% of our community is not. We have much work to do. So until next time, much love, beloved. And don't forget the 3 things we do. We live, we love, we serve. Peace and blessings, and have an amazing night.